Hello everybody, welcome back to our channel Nursing Career Club. Today we will discuss about Home Health Ed Unit 7 Therapeutic Communication with Patient at Home. Introduction. Communication refers to the reciprocal exchange of information, ideas, beliefs, attitudes between person and among group of person. It is goal redirected process in nursing. It is used in nursing process. So there is a different type of communication between the HHA and the doctors. So they complete their tasks throughout this communication. So this is very necessary to communicate with each other while the treatment is going on in the hospital. Now what definition of communication? Communication is process by which information is exchanged between individuals through common system of sign, symbol or behavior. So simply we can say that communication is such a thing that we transfer our ideas to another person via sign, symbol, or behavior. That is called communication. Now we will discuss about communication process. So this starts from message, decoding, receiver, feedback, sender, noise. This is all about communication process. Now we will define therapeutic communication. In therapeutic communication, the nurse directs the communications towards the patient to identify his current health problem, plan, implement and evaluation the action taken. Goal of therapeutic communication: establish a therapeutic nurse-patient relationship, identify the most important patient's needs, assess the patient's perception of the problem, facilitate the patient's expressions of emotions, implement intervention designed to address the patient's need. Principle or characteristics of therapeutic communication. The patient should be the primary focus of interactions. A professional attitude sets the tone of the therapeutic relationship. Use self disclosure continuously and only when it has a therapeutic purpose. Avoid social relationship with patients. Maintain patient confidentiality. Assess the patient's intellectual competence to determine the level of understanding, implements interventions from a therapeutic base, maintain a non-judgment attitude, avoid making judgment about patient's behavior, avoid giving advice, guide the patients to interpret his or her experiences rationally. Now, first one is listening. This is a therapeutic techniques of communication. It is an active process of receiving information, response on the part of the nurse, such as maintaining eye to eye contact, nodding, gesturing, and other form of receptive non-verbal communication. Convey to the patient that he is being listened and understood. Broad openings. Encouraging the patient to select topics for discussion. Example, what are you thinking about? So listening is such a process that if a person giving a lecture, then at that moment the audience and any other listeners are listening in a proper way and getting the ideas, and they are also understanding the values of the communication. Restating, repeating the main thought expressed by the patient, Example, you say that your mother left you when you were 5 years old. Res- Restating means that we will again explain our thought, that is called restating. Clarification, attempting to put vague ideas or unclear thoughts of the patients into words to enhance the nurse understanding or asking the patient to explain what he means. Clarification, we can define clarification as it is an approval or satisfaction by a person, that a person gives his ideas and thoughts with a consent, that is called clarification. Example, I am not sure that what you mean, could you tell me about that again? This is all about clarification. Now we will talk about reflection, directing back the patient ideas, feelings, questions, and content. You are feeling tense and anxious, and it is related to a conversation you had with your husband last night. So, this is all about reflection, that we are reflecting our ideas onto a person, and we are giving feedbacks to a person, then he or she is receiving as reflection. Humor, the discharge of energy through comic enjoyment of the imperfect. Humor means when a person laughs and joy expresses his joy at the moment, that is called humor. Example, that gives a whole new meaning to the word nervous, said with shared kidding between the nurse and the patient. Now we will talk about information, the skill of information giving. Example, I think you need to know more about your medication. Information is such a thing that it is a piece of a secret ideas and any other hidden news. If we are sending a news to another person via email, chat, and call, that mode is called information. Focusing, questions or statements that help the patient expand on a topic of importance. Example, I think that we should talk more about your relationship with your father. Focusing means that we pay attention on a thing and we see that thing with a concentration, then we can say that we are focusing in a proper way. Sharing perceptions, asking the patient to verify the nurse understanding of what the patient is thinking or feeling. Example, you are smiling, but I sense that you are really very angry with me. Sharing perceptions mean that we are sharing our ideas with each other. That is called sharing perception. Now we will discuss about theme identification. This involving identification of underlying issues or problem experienced by the patient that emerge repeatedly during the course of the nurse-patient relationship. Theme identification means that a HHA, when a HHA comes into the interaction with the nurse, then he replies all the questions of the nurse, and he also add some themes or his own ideas while replying to the nurse. That is called theme identification. As an example, I noticed that you said have been hurt or rejected by men. Do you think this is an underlying issue? Now we will discuss about silence. Lack of verbal communication for an therapeutic reason. Example, sitting with a patient and non-verbally communicating interest and involvement. Silence means when we sit silent and we don't speak any kinds of words, and AHHA is sitting silently. He or she is not talking with the patient. That is called silent. It means that sitting with a patient and non-verbally communicating interest and involvement. Now we will discuss about suggesting. Suggesting means that give a piece of advice. If we give a piece of advice to the patient or to the HHA, that is called suggestion. Presentation of alternative ideas for the patient's consideration relative to problem solving. As an example, have you thought about responding to your boss in a different way when he raises that issue with you? You could ask him if a specific problem has occurred. Now, this is all about suggesting. Now, we will talk about non therapeutic techniques. Non therapeutic techniques are as follow: reassuring, rejecting, giving approval, advising, defending, requesting, belittling the feeling of the patient. Reassuring means we are assured for a thing that is called reassuring. We again assure for the idea or a thing that is called reassuring. Rejecting means we are making a person unqualified for the exam or for the treatment process, that is called rejecting. Giving approval. If we are accepted with the given task, then it is called giving approval. Advising means we give a piece of news to other person, that is called advising. Or we suggest a patient to take medicines on time, that is called advising. Depending means it is the self protection. We are protecting our body from various diseases, so it can be called defending. Requesting means we are praying a person to do a task, and we are saying a person that please help me, please give me please give me some water, please give me some money. This is a type of requesting. This is all about non-therapeutic techniques. Communication failure. Failure to perceive the patient as human being, failure to recognize the level of meaning in communication, failure to listen, failure to interpret with knowledge, use of close-ended questions only, conflicting verbal and non-verbal, giving false reassurance, changing subject if not comfortable. This is all about our topic, therapeutic communication with patient at home. I hope that this video will be helpful for you. And if you want to ask a question, then you can comment in our comment section. And if you want to take our notes, then you can visit on our official website www.nursingcareerclub.com. Thank you again. We will see you in the next video.